You go for a routine checkup, expecting everything to be normal, but then your doctor tells you there's protein in your urine. Instantly, your mind races with questions. What does that mean? Is your kidney in trouble? It's a moment of uncertainty, and you can't help but wonder if this could be the first sign of a more serious issue. Protein in urine, also known as proteinuria, can be a cause for concern, but it doesn't always mean disaster is looming. Your kidneys are supposed to filter waste products from your blood, keeping essential proteins in the bloodstream where they belong. When these proteins start leaking into your urine, it can be an early indicator that something isn't quite right with your kidneys. On the other hand, you might have noticed bubbles in your urine, something that might seem insignificant at first glance. You ask yourself, should I be concerned? Or is this completely normal? Bubbles in urine can be caused by something as simple as the speed or force with which you're urinating, or even by mild dehydration. But when these bubbles are persistent or accompanied by other symptoms, they can also be a sign of protein in your urine, linking back to potential kidney issues. It's a confusing and worrying scenario, leaving you to question whether what you're experiencing is just a harmless quirk or a signal of something more serious. These are the kinds of questions that could be life-changing, yet most people don't even realize they need to ask them. It's easy to overlook the subtle signs our bodies give us, assuming that everything is fine until something major happens. But the truth is, understanding what's happening with your urine, whether it's the presence of protein or the appearance of bubbles, could be the difference between catching a problem early or facing serious kidney issues down the road. It's not just about worrying over nothing. It's about being informed and proactive with your health. So stick around, because what you're about to learn could save your kidneys and potentially prevent a lot of heartache in the future. Protein in urine, known as proteinuria, is a condition that occurs when an abnormal amount of protein is found in your urine. Under normal circumstances, your kidneys play a crucial role in maintaining your body's balance by filtering out waste products and excess water from your blood, which then becomes urine. However, they are designed to keep essential proteins, like albumin, within your bloodstream, where they perform vital functions such as maintaining fluid balance, fighting infections, and repairing tissues. When your kidneys are functioning properly, only tiny insignificant amounts of protein should pass into the urine. However, if your kidneys are damaged or not functioning as they should, these essential proteins can begin to leak through the kidney's filters, the glomeruli, and end up in your urine. This leakage is not just a minor malfunction. It can be an early warning sign of kidney damage or disease. Proteinuria might be temporary or a sign of a chronic condition like kidney disease, diabetes, or high blood pressure. Identifying protein in your urine is crucial because it can help diagnose kidney issues before they progress to more serious stages, where the damage could become irreversible. Conditions like high blood pressure, diabetes, and kidney disease are among the most common culprits behind proteinuria. High blood pressure or hypertension can damage the blood vessels in your kidneys, making it difficult for them to filter your blood properly. This damage can allow proteins, which are usually retained in the bloodstream, to escape into the urine. Similarly, diabetes, particularly when it's poorly controlled, can harm the delicate filtering system of the kidneys over time. Elevated blood sugar levels can lead to a condition called diabetic nephropathy, where the kidney's filtering units, called glomeruli, become scared and leak protein into the urine. This is one of the leading causes of kidney failure if not managed effectively. Chronic kidney disease, CKD, itself is another major reason why protein might be found in urine. CKD can be the result of various underlying conditions, including high blood pressure and diabetes, and it typically develops gradually, with proteinuria often being one of the earliest signs that something is wrong. As kidney function declines, more and more protein escapes into the urine. However, it's important not to panic if you've been told you have protein in your urine. The presence of protein can vary in severity, and not all levels of proteinuria are a cause for immediate alarm. Mild or transient proteinuria can occur for a variety of reasons, such as dehydration, stress, or even after intense physical exercise, and it may resolve on its own without any intervention. Your doctor will usually assess the amount of protein in your urine, the presence of other symptoms, and possibly perform additional tests to determine whether it's a sign of something more serious or simply a temporary condition. Bubbles in your urine can be caused by a variety of factors, and in many cases, they are completely harmless. Sometimes, it's as simple as the speed or force with which you urinate. When urine hits the toilet water quickly, it can create bubbles or foam, much like when water is poured forcefully into a sink or glass. This is a common occurrence and usually nothing to worry about. Dehydration is another benign cause of bubbles in urine. When you're dehydrated, your urine becomes more concentrated, which can result in foaminess when it's expelled from your body. This type of bubbling typically resolves itself once you rehydrate. However, there are instances when bubbles in urine might indicate an underlying problem that warrants further investigation. Persistent bubbles that don't go away, especially if they are accompanied by other symptoms like swelling, fatigue, or changes in urination frequency, could be a sign of protein in the urine. This condition, known as proteinuria, can sometimes be associated with kidney damage. When the kidneys are not filtering blood properly, proteins that should remain in the bloodstream can leak into the urine, causing it to froth or bubble. If you notice that the bubbles in your urine are not going away over time, or if they appear consistently in every urination, it's important to take note and consult with a healthcare provider. This could be an early indicator of a more serious issue, such as kidney disease, and catching it early can make a significant difference in treatment outcomes. Additionally, bubbles that are persistent and accompanied by other symptoms might suggest conditions like urinary tract infections, UTIs, or other systemic issues that affect kidney function. In such cases, a thorough medical evaluation is essential to determine the cause and appropriate treatment. Bubbles in urine can sometimes be linked to the presence of protein in the urine, a condition known as proteinuria. When there is an abnormal amount of protein in the urine, it can cause the urine to become frothy or bubbly. This happens because proteins, such as albumin, have surface active properties that can trap air and create bubbles. In a healthy person, these proteins are usually retained in the bloodstream by the kidney's filtering units, called glomeruli. However, when the kidneys are damaged or their filtering capacity is compromised, these proteins can leak into the urine, leading to the formation of bubbles. The presence of persistent bubbles in the urine, particularly if the urine also appears frothy, is often a sign that there is a significant amount of protein being excreted. This can be an early warning sign of kidney damage or disease. The kidneys play a crucial role in filtering waste and excess fluids from the blood while keeping essential substances, like proteins, within the body. When their filtering system is impaired, proteins leak into the urine, which not only leads to bubbles, but also signals that the kidneys are not functioning properly. If you're noticing persistent bubbles in your urine and seeing them frequently, especially if the urine appears frothy or there are other symptoms like swelling or fatigue, it's important to get checked out by a healthcare provider. Persistent proteinuria can be an indicator of underlying conditions such as chronic kidney disease, diabetes, or high blood pressure, all of which can lead to serious kidney damage if left untreated. Early detection and management of these conditions are vital for maintaining kidney health and preventing further complications. Therefore, consistent frothiness in your urine should never be ignored, as it might be the body's way of signaling that your kidneys need attention. When proteinuria or problematic bubbles in urine occur, they are often accompanied by other symptoms that can provide further clues about your kidney health. One of the most common accompanying symptoms is swelling or edema, particularly in areas like the ankles, feet, or around the eyes. This swelling occurs because the kidneys are not effectively filtering out excess fluids, leading to fluid buildup in the body's tissues. If you notice that your shoes feel tighter than usual, or that you have puffiness around your eyes in the morning, this could be a sign that your kidneys are struggling. Another symptom that often goes hand in hand with proteinuria is fatigue. This type of fatigue is not just ordinary tiredness. It's a deep, pervasive exhaustion that doesn't go away with rest. The kidneys play a vital role in maintaining the balance of electrolytes and red blood cell production in the body. When they are not functioning properly, it can lead to anemia and a buildup of toxins in the bloodstream, both of which contribute to feeling unusually tired and weak. Changes in urination frequency and appearance can also signal kidney issues. You might find that you are urinating more frequently, especially at night, or conversely, you might notice a decrease in the amount of urine you produce. The color of your urine might change as well, appearing darker or more concentrated. These changes are often subtle at first, but can become more pronounced as kidney function deteriorates. If you're experiencing any of these symptoms alongside bubbles in your urine, it's essential to speak with a healthcare provider as soon as possible. These symptoms, particularly when they occur together, can be early signs of kidney disease or other serious health conditions that require prompt diagnosis and treatment. Ignoring them or delaying medical consultation could lead to more severe complications, so it's crucial to take these signs seriously and seek professional advice. Urine tests, blood tests, and other diagnostic tools are crucial in determining whether the protein levels in your urine are harmful and to assess the overall health of your kidneys. When protein is detected in your urine, it's important to determine whether this is a temporary condition or a sign of something more serious, like chronic kidney disease. This is where diagnostic tests come into play, providing a clearer and more detailed picture of what's happening inside your body. One of the first tests your doctor might order is a urinalysis, a simple yet effective test that can detect the presence of protein, blood, and other substances in your urine. This test provides a snapshot of your kidney function and can reveal abnormalities that might not yet be causing noticeable symptoms. A urinalysis can help identify the type of protein present and give clues about its potential causes. In some cases, your doctor might recommend a 24-hour urine test, which is more comprehensive than a single urinalysis. Over the course of 24 hours, you collect all your urine, which is then analyzed to measure the total amount of protein excreted by your kidneys during that time. This test is particularly useful for understanding the extent of protein leakage and determining whether it's within a normal range or indicative of kidney damage. Blood tests are also a key component in the diagnostic process. Tests like serum creatinine and blood urea nitrogen, BUN, levels provide insight into how well your kidneys are filtering waste from your blood. Creatinine, a waste product from muscle metabolism, is normally filtered out by healthy kidneys. High levels of creatinine in your blood can indicate reduced kidney function. Additionally, your doctor may measure your glomerular filtration rate, GFR, which estimates how much blood your kidneys filter per minute. A lower GFR suggests impaired kidney function and helps gauge the severity of the condition. In some cases, imaging tests, like an ultrasound or CT scan, may be necessary to get a visual understanding of your kidney structure and to check for any abnormalities like cysts, tumors, or blockages that could be contributing to proteinuria. The results of these tests collectively help your doctor determine whether the protein levels in your urine are harmful and what might be causing them. They also guide the next steps in managing your kidney health, whether that involves lifestyle changes, medication, or further monitoring. Early and accurate diagnosis through these diagnostic tools is essential for preventing more serious kidney damage and ensuring that you receive the appropriate treatment to maintain your overall health. Not all cases of protein in urine or bubbles indicate kidney damage. In fact, there are several lifestyle factors and temporary conditions that can lead to these symptoms without signaling any serious health issues. For instance, intense exercise can cause a temporary spike in protein levels in your urine. When you engage in strenuous physical activity, your body undergoes significant stress, which can lead to a temporary increase in protein excretion. This is usually a short-term effect and often resolves on its own once your body recovers. Stress is another factor that can influence the presence of protein in your urine. Emotional or physical stress can cause changes in your body's functioning, sometimes leading to proteinuria. This is typically mild and transient, meaning it goes away once the stressor is removed or managed. Similarly, dehydration can concentrate your urine, leading to both bubbles and a higher than normal protein concentration. When you're dehydrated, your kidneys work harder to retain water, which can temporarily affect their filtering efficiency, resulting in protein leakage. Even dietary factors can play a role. For example, A diet high in protein might cause a temporary increase in protein excretion as your body processes the excess. These instances of proteinuria are generally not cause for concern and do not indicate any underlying kidney damage. Given these possibilities, your doctor may suggest a period of monitoring rather than rushing into further testing if protein is found in your urine under such circumstances. This approach allows time to see if the proteinuria resolves on its own as your body returns to normal conditions. During this monitoring period, your doctor might recommend lifestyle adjustments, such as ensuring proper hydration, managing stress, or moderating exercise intensity. If the proteinuria persists or is accompanied by other symptoms, further investigation may be warranted. However, in many cases, these symptoms are benign and temporary, and with careful monitoring, they can often be distinguished from more serious kidney conditions. The key is to understand that while protein in urine and bubbles can be concerning, they are not always indicative of kidney damage, and sometimes a wait-and-see approach is the best course of action. Protecting your kidney health is essential, and there are several actionable steps you can take to ensure your kidneys continue to function optimally. One of the simplest and most effective ways to support your kidneys is by staying well hydrated. Drinking enough water throughout the day helps your kidneys filter waste from your blood and prevents the formation of kidney stones. Aim to drink at least 8 glasses of water a day or more if you're active or in a hot climate. Managing your blood pressure is another critical aspect of kidney health. High blood pressure can damage the delicate blood vessels in your kidneys, impairing their ability to filter blood properly. To keep your blood pressure in check, focus on a diet rich in fruits, vegetables, whole grains, and lean proteins. Reducing your intake of salt is particularly important, as excess sodium can lead to elevated blood pressure. Limiting processed foods, which are often high in salt and unhealthy fats, is also crucial for maintaining a healthy diet. In addition to diet, regular physical activity plays a vital role in keeping your kidneys healthy. Exercise helps regulate blood pressure, blood sugar levels, and body weight, all of which are important factors in kidney health. Aim for at least 30 minutes of moderate exercise most days of the week, whether it's walking, cycling, swimming, or another activity you enjoy. Maintaining healthy blood sugar levels is especially important if you have diabetes or are at risk for it. High blood sugar can damage your kidneys over time, leading to conditions like diabetic nephropathy. If you have diabetes, work closely with your healthcare provider to manage your blood sugar through diet, medication, and regular monitoring. Your kidneys are resilient, but they need your help to stay healthy. Avoid excessive consumption of salt, sugar, and processed foods, which can all contribute to kidney damage over time. Instead, focus on a balanced diet that supports overall health. Stay active to keep your blood pressure and blood sugar levels in check, and make sure to stay hydrated. If you're ever concerned about protein in your urine or bubbles, the best thing you can do is consult with a healthcare provider. Early intervention can make all the difference in preventing or managing kidney-related issues. Don't wait until symptoms worsen. Getting a professional evaluation can provide peace of mind and help catch any potential problems before they become serious. Regular checkups and listening to your body are key components in maintaining kidney health and ensuring a long, healthy life. To summarize, protein in your urine can indeed be a sign of kidney damage, but it's important to remember that it's not always the case. There are various reasons for protein to appear in your urine, some of which are temporary and harmless, like after intense exercise or due to dehydration. Similarly, bubbles in your urine can often be normal, caused by something as simple as the speed of urination or mild dehydration. However, if these bubbles are persistent and frequent, they could be an indicator of a more serious issue, such as proteinuria, which may signal underlying kidney problems. The key takeaway here is to be proactive about your health. Don't wait until it's too late. Regular checkups and paying attention to what your body is telling you are essential steps in maintaining your kidney health. By catching potential issues early, you can address them before they become serious problems. If you found this information helpful, please give this video a thumbs up, and don't forget to subscribe for more tips on how to keep your kidneys and the rest of your body healthy. Your support helps us continue to bring you important health information, so hit that subscribe button and stay informed.